Hi, welcome back to my YouTube channel. On this video, I'll be talking about patients' adherence to medication. Uh, I realize that most of the patients, cannot differentiate between short-term diseases and long-term diseases, so to say, acute and chronic diseases. Short-term diseases are those diseases that do not last long. They just erupt out of something. For instance, maybe you just you fall and then you hurt your arm, and probably maybe just having a migraine or something, or headache. Yeah, those are diseases which are short term. Maybe you're having gastroenteritis, that are stomach upset, and maybe you're having a chest infection, that is an acute chest infection that does not require long-term treatment. And then we have these chronic diseases that require a long-term medication. For instance, hypertension or asthma, depending on the severity of the asthma. If you're having maybe a moderate to severe type of asthma, if you're having maybe TB, in case you're having probably diabetes disease. So, for short-term diseases, you'll require to take medication only for that period of time when the symptoms are up. When the symptoms are low, then you can stop taking the medication. And for chronic diseases, you will need to take medication for a longer period of time, and some of them would be lifetime treatment. For instance, like in cases of hypertension, in cases of HIV, you'll be forced to take medication for a long time. And for some diseases have, as you take medication for a period of time longer than in short-term diseases. I mean, in acute cases. For instance, for peptic ulcer diseases, for some mild type of asthma and all that, you'll be taking medication maybe for a specified period of time that is longer than 2 weeks, so to say. But unfortunately, patients do not know about all this. So, sadly enough, patients with chronic diseases would be taking medication as if they were suffering from a short-term disease or an acute disease, which is a very sympathizing situation. It's a pitiful situation in the sense that these long-term diseases, they have a tendency of complicating. So when one does not adhere to medication, then they risk the chances of developing the complications earlier enough. I've had patients coming to my office telling me that, oh, I've been on this medication. This is like the second year or third year I've been suffering from this disease, for instance, peptic ulcer disease, but I've not cured. Then you ask them about the history or about the adherence to medication. For instance, how have you been taking the medication? And you'll be shocked to learn that they're taking the medication only when they feel the symptoms are up. For instance, one will tell you, oh, when I take spicy stuff, that's when I get to have a stomach ache, so that's when I'll be taking medication and all that. And for hypertension, they tell you, oh, when I feel like, oh, today I have a light head, I'm feeling like lightheaded, and probably when I have a headache or something, that's when I will be taking my antihypertensive and all that. It's so pitiful in the sense that in today's world, when everything, all the knowledge is out there in the open, you find patients doing such kind of things. It symbolizes that they are not intact with what they're suffering from. They really do not know the diseases that they're suffering from and all that. We as medics need to do much. We need to give a lot of health talks. We need to create enough awareness to our patients. That's this video. So if for instance, you are suffering from chronic disease, then please know that you are not supposed to stop medication earlier than the time that you are allocated. Neither are you supposed to take medication only when you feel that you have the symptoms. For hypertension, it's a lifetime disease, so you need to take medication throughout. There are no shortcuts to those things. Otherwise, if you start taking medication when you wish, or when you feel that you have the symptoms, then you are risking to have complications. For instance, hypertension can give you complications to do with your liver, with your kidneys, with your heart, with your eyes, with your brain. If you've had people suffering from stroke, had people going through blood dialysis and all that, these are complications of hypertension. Okay, so it's not good, it's not okay to take medication only when you please. If you've had cases of TB complicating, like for instance, if you've had someone suffering from drug resistance TB, then the chances are high that someone did not complicate the initial medication when they were initially diagnosed with a certain type of TB. If you was given a specific duration period of time to take medication, then you have to adhere to that. Otherwise, you risk developing this complication earlier in advance. So it's such a pity. And for patients, it's very it's your right to inquire about the period of treatment from the doctor before you leave the office. Just ensure that you fully understand what you're suffering from and what is expected of you. If you are prescribed some medication, get to know the duration of the medication, because sometimes we are also human beings. Sometimes we get to tell patients, we get to share enough knowledge with patients, but at times we fall short. So it is your right as a patient to know that I'm suffering from this disease and my treatment would last this long. If you are required to come back for a refill, then let that be known by you in advance, so that you know that before you finish your medication, you're not supposed to stay to have a gap in between your first dose to your second dose. No, you're supposed to ensure that there is continuity, so you go back for your medication before you finish the first dosage of medication that you are initially prescribed. It's really sad that patient would come to us when it's too late, when they're already suffering the complications. And due to that, I thought that this video would be very important. It's eminent that at least patients learn that there are different types of diseases, and in these different types of diseases, people are prescribed medication for a certain duration, and there are no shortcuts to that. Okay, so adhere to medication. Ensure that you're taking your meds as rightfully prescribed by the doctors. There are no shortcuts, otherwise you risk the chances of developing complications. Okay, I hope that this knowledge is well taken. If you shall have any questions, please post them down on the comment section. And if you'd like me to discuss any other topic of choice, please comment. Then I'll go through and see which topics to go by. Please like and subscribe. Sorry, we doctors, we're so used to prescribing, so everything is prescribing anyways. Please like and subscribe, so that I can be making a lot of these health talks, so that at least the knowledge is out there and people get to know what to do widely, globally. Thank you. Okay, next time.